What does HRV mean? Heart rate variability, heart rhythm variability, or heart frequency variability. There are different terms for the measurement and analysis of RR intervals, the QRS complex of ECG signals. The more variable and different the time intervals from heartbeat to heartbeat at rest are, the healthier we are, because we can react optimally to different stimuli.
HRV is a unique and holistic health parameter and gold standard in medicine. HRV shows how well the body handles stress. HRV analysis provides showing the current stress level and stress regulation, continuous therapy monitoring, control of the dosage of medication, for example beta blockers, evaluating the effectiveness of therapeutic interventions, medications, or nutritional supplements, psychological perception and decisions, life circumstances, effective training control for amateur and professional athletes for a higher performance output.
What exactly is measured in HRV analysis? In an ECG signal, there is the QRS complex with R-spike. In HRV analysis, the time intervals from R-spike to R-spike, or the RR interval, are measured in milliseconds. What do these intervals from heartbeat to heartbeat tell us exactly? The heart is an organ of success, whereby the rhythm of the heartbeats is permanently regulated by the autonomic nervous system, the ANS. The continuous adaptation of one heartbeat to the next heartbeat is essential and part of our survival program.
Every second of our life, the autonomic nervous system autonomously controls and regulates all organs and cells from the background. Blood pressure, vasoconstriction and vasodilatation, energy production, oxygen uptake and transport, heart rate, blood flow and blood distribution, digestion, food intake and digestion, immune system, immune function and intelligence, hormone production, metabolic regulation and reproduction, perception, sensory systems and stimulus management, repair processes, wounds, injuries, and regeneration.
How do stress situations influence the heart? Stress and tension are biologically interpreted as fight and flight and lead to an increase in heart rate, of pumping volume, an increase of blood pressure, and in the amount of oxygen. The biological sense is in fight and flight situations to mobilize all energy reserves to survive. Our today's fight and flight reactions may be a quarrel with a partner or children, stress with colleagues or our boss, permanent financial trouble, or letters from authorities.
Stress situation, influence on the lungs, hyperinflation of the pulmonary vesicles, alveoli, increase in respiratory rate, increased oxygen uptake for energy production, ATP. The biological sense, survival, mobilization of all energy reserves.
How do stress situations influence the intestine? Stress and tension lead to a slowdown of intestinal activity and food digestion in the intestine. The biological sense? In the fight for survival situation, food intake, digestion, and excretion of food is not beneficial for the survival. Sympathetic dominant. Here are some examples for this. Sports and competitive situation, current relationship conflicts, general interpersonal dispute, exam fear, a current accident, or a shock diagnosis from the doctor.
In a relaxation situation, biologically interpreted as relaxation and regeneration, the influence of the parasympathetic nervous system reduces the heart rate. Examples for a dominant parasympathetic nervous system after a sport and competition situation, during bedtime, when we relax or meditate, after resolving a conflict situation, after the all clear of a previous shock diagnosis. Due to the constant regulation of the heart rate in every second of our life, a direct and immediate connection to the current situation of the autonomic nervous system is visible.
What are our measurement parameters? HR stands for heart rate. The heart rate is the average number of heartbeats per minute. SI is our stress index, or the sympathetic activity. The stress index shows the stress on the body and gives information about the stress level. RI is our rest index, or parasympathetic activity. The resting index gives information about the relaxation and recovery state of the body. How can you identify stress and permanent stress at an early stage? Quick overview of all measurements. The rhythmogram. The rhythmogram shows very quickly whether there is high or low variability. The histogram. The percentage distribution of all measured values according to areas. The more bars, the better the health status. The scatter plot. The more extensive the point cloud is, the greater the variability. Independently identify permanent stress at an early stage. Check therapy interventions and monitor the balance between tension and relaxation.